Welcome to Medical Monday. I'm your host, Jessica Hill, and the Director of Nursing here at Southeastern Community College. Thanks for tuning in. As you are probably aware, October is Breast Cancer Awareness Month. So it only seems fitting to discuss breast cancer for this month's Medical Monday topic. It's almost impossible to make it through life these days without breast cancer impacting your life in some way, whether you experience it personally or you know someone who has been through a breast cancer diagnosis. Knowledge is key when it comes to promoting health and wellness. So today's focus is all about building knowledge and awareness related to breast cancer. So what is breast cancer? Breast cancer is the second most common cancer in women in the United States. On average, 1 out of every 8 women in the United States will develop breast cancer at some point in her lifetime. Of all new cancer diagnoses for women each year, about 30% of those cases will be due to breast cancer. There are so many different types of breast cancer, so learning and understanding each type can be very difficult, even for healthcare professionals. A very simple definition of breast cancer is just an out-of-control growth of cells that starts in the breast. As this abnormal growth of cells occur, oftentimes there's a formation of a lump that can be felt. This is why self-breast exams are so important for early detection. What causes breast cancer? It is really hard to pinpoint direct causes of breast cancer, but we do know that some people are at a greater risk for developing breast cancer, so understanding and identifying your risk factors are really key. What are the risk factors? In healthcare, we think of risk factors as being in a couple of different categories. There are risk factors that you can change, and there are risk factors that you can't do anything about. For breast cancer, some things or risk factors that you cannot change are things like being born a female. Although we know that men can get breast cancer, it's much more likely in females. Also, getting older. The older you are, the greater your risk. Being tall increases your risk of breast cancer. If you have dense breast tissue, if you start your menstrual cycle early and you go through menopause late, all of those things increase your risk for breast cancer. White women have a slightly increased chance of breast cancer. However, African American women under 40 develop breast cancer more commonly. Also, women have certain breast cancer conditions that are non-cancerous that can increase their risk of developing breast cancer in the future. Another thing that you cannot change that puts you at risk for getting breast cancer are inherited genes. Though you can't do anything about those. They are what they are. However, we do know that there are a few things that you can do to decrease your risk of developing breast cancer. Drinking less alcohol, making sure that you're at a good weight. Individuals who are overweight or obese have a greater likelihood of developing breast cancer as they age. Not being physically active. Physical activity seems to be connected to everything health related. So increasing your activity for at least 5 hours a week is really ideal and what is recommended to decrease your risk for breast cancer. A couple of other things are not having children and not choosing to breastfeed. Those things can impact your risk of breast cancer slightly. And then hormone replacement therapy. Oftentimes as we age and we begin to go through menopause, women choose to take hormone replacement therapy to control menopausal symptoms. And we also use it for other things. So talking with your physician and understanding the pros and cons of hormone replacement therapy are important. What are some breast cancer signs and symptoms? Most commonly, women find a lump or a mass in their breasts. And although many times these lumps or masses are non-cancerous, they should always be checked by a healthcare professional because they can put you at an increased risk for developing breast cancer in the future. Swelling of all or parts of your breast, even if there is no lump, that should be checked out. Skin dimpling, breast or nipple pain, or nipple abnormalities. Skin that is dry, red, or flaky, or that has thickened is also something that should be checked out by your healthcare professional. If you have discharge from your nipples that is not breast milk, that's important to have that looked at. And then swollen lymph nodes under the arm or near your collarbone are also important things that you would need to report to your healthcare provider. The key to survival is early detection. So get your mammograms done. Screenings are tests in healthcare that we do to help find a disease before it begins to cause symptoms. So remember that a breast lump that you can feel is a symptom of breast cancer. Sometimes we can find breast cancer through mammograms before you can even feel a lump. And the chances are that oftentimes, hopefully, that cancer has not spread if it is that small. So early detection, again, is key. Schedule your mammogram if you're 40 or older. And women who have reached the age of 40 should be getting a mammogram every year. And that means for women who are at average risk of breast cancer, if you have a really high risk of developing breast cancer, talk to your physician about what you can do even earlier than 40. The other key is your self-breast exams. Be diligent about doing your self-breast exams once a month. Knowing how your breasts are normally, how they normally look, how they normally feel is a really important key to detecting abnormalities that could be cancerous. So make sure to do those once a month and to cover all the areas of your breast, from your axilla all the way down to the upper top of your abdomen, from one side to the other, and don't miss any areas.
I am a 13-year breast cancer survivor. I was aware that I had breast cancer by a mammogram. I had a mammogram done back about 2005. I had a small lump in my breast that was removed, and it was benign. So therefore, every year after that, I got a mammogram on a yearly basis. And in 2009, my mammogram came back suspicious. I had a biopsy done, and it came back as breast cancer. So I had a double mastectomy, and since then I have had reconstruction surgery. So this has all happened from 2009 with me.
Okay. So I heard you say that you had a lump removed.
Yes.
How did you find that lump? Were you doing a self-breast exam or?
I was very diligent in doing self-breast exams once a month. Upon doing one, I found a small lump in my upper right-hand quadrant of my breast, and went to my surgeon, and that's when he did the biopsy. That was there.
And it was benign.
And it was benign. So 4 years later, by a mammogram, I came back with another little mass in there, and this time it was malignant. So I had my breast removed at that point. A lot of people just do lumpectomies at times, and due to the fact that I did have some lymph node involvement, I decided to do a double mastectomy at that time.
Yeah, because there are a lot of individuals who may find that they have breast cancer and decide just to remove the tumor or the lump. So you chose to do the full double mastectomy and remove both breasts, even though you only had one that was involved.
I did not have any family history of breast cancer as far back as we could go. My mother did have ovarian cancer, which they say is kind of a cousin to breast cancer. But ironically, with me having breast cancer, my oldest daughter at 47 found a lump in her breast. She was doing self-breast exams also. And it also was cancerous. And she decided at that time that she would have a double mastectomy, which she had done. My youngest daughter, at 47, decided to have some genetic testing done, and she was at a high risk for breast cancer. And prophylactically, she had both her breasts removed and reconstructed. So
wow. So even though your mother did not have a history of breast cancer, your daughters, on the other hand, have had some experience.
Yes. Mm-hmm.
Wow. So if you could tell everybody maybe one thing that was brought to light whenever you were diagnosed that you maybe did not know beforehand, what would you say was like your aha moment after diagnosis? Like the one thing you didn't know that you found out that made a significant impact on you?
Well, I found out with having a lymph node involvement, and I only had one lymph node involved in this process. I did not realize that that bought me chemotherapy.
Wow.
And that in itself was a eye-awakening experience, the chemotherapy itself. That was the hardest part of anything dealing with breast cancer.
Right.
Was
But you're here.
But
right?
I'm here 13 years later. I am here. My daughters and I do kind of a neat thing now. For every year that I'm a survivor, I add a pearl to my necklace.
Oh.
And my granddaughter and both my daughters have a necklace that we add a pearl to every year that I'm a survivor.
That is, I did not know that. That is fabulous.
Yeah.
I love that.
Yeah.
If you could share some advice with our viewers today, being a survivor, what would you say to our viewers?
Be aware of your family history, number one. Try to go back and see if you can find out anything about anybody in your family that may have had breast cancer in the past. Know your history, your genealogy, to find that out, and to be very diligent with your self-breast exams and making sure that when you do find something that you, even how minor it may seem, that you go have it checked out.
So follow up.
Follow up with it, exactly, yes.
Thank you so much for being here and sharing your experience.
You're welcome.
Make sure to always check in with your healthcare provider every year. There are some local resources that are available to our citizens. The Columbus County Health Department has a breast and cervical cancer control program. So check with the Columbus County Health Department about more information on that program. And also, Columbus Regional Healthcare System is having a Mammoglam event on October 14th from 1 to 3 p.m. at the hospital. So make sure to check out that event if you're 40 or older. Thank you for joining us for Medical Monday, our very first episode, where we're giving you information on breast cancer awareness for the month of October. Stay well.